Welcome to the Medical Insights podcast, where we explore challenging topics in medicine.
I am delighted to be here and share my expertise with our listeners now.
Good morning, everyone. Today we discuss a case involving a newborn weighing 4.5 kg.
That weight is significant and may indicate macrosomia or other underlying issues next.
Our first focus is on identifying the spotter in such cases.
The spotter is essentially an early indicator that signals potential neonatal complications next.
What factors typically cause a newborn to have a high birth weight?
Maternal hypoglycemia and genetic predispositions are the usual causes next.
In cases of mothers with gestational diabetes, what complications can arise for the baby?
Complications may include hypoglycemia, respiratory distress, and possible jaundice next.
Moving to our next segment, can you name the screening test used in prenatal care for these conditions?
The test commonly referenced is the glucose challenge test, used to screen for gestational diabetes next.
What underlying causes lead to a positive result on this test?
Insulin resistance and hormonal imbalances often contribute to a positive result next.
Could you outline the surgical procedures that might be considered if the condition requires correction?
Depending on the diagnosis, surgical interventions may include corrective vascular procedures or other structural corrections next.
Let us return to the concept of the spotter in a different context.
In that context, the spotter refers to indicators found during physical examinations that highlight abnormal growth patterns next.
What clinical presentations should we observe in such scenarios?
Look for signs such as physical asymmetry and other dysmorphic features next.
Where are the common sites of implantation in these cases?
Implantation can occur in regions ranging from the uterine fundus to lower segments next.
Now we shift to an image used in our material. What does the image show?
The image depicts abnormal tissue growth that aids in reaching an accurate diagnosis next.
When interpreting graphs in clinical studies, what three components are most important?
The axes, the distribution of data, and the trend lines are essential for proper interpretation next.
Could you enumerate two risk factors for obstructed labor?
Fetal macrosomia and maternal pelvic structure abnormalities are key risk factors next.
Returning to the newborn weighing 4.5 kg, what implications does this have for postnatal care?
It signals a need for intensive monitoring, especially in relation to blood sugar levels and respiratory function next.
How frequently do macrosomic infants appear in clinical practice?
They are increasingly observed, particularly in cases complicated by gestational diabetes next.
What immediate interventions might be recommended for these infants?
Immediate postpartum blood sugar monitoring and supportive care measures are often initiated next.
Is there a specific time period after birth when these complications are most concerning?
The first 24 to 48 hours after birth are critical for detecting any neonatal distress next.
How does the presence of macrosomia impact decisions regarding delivery methods?
It can necessitate a cesarean section, since a vaginal delivery may be complicated by the infant size next.
What vital role does ultrasound imaging play in these cases?
Ultrasound is a non-invasive tool that accurately assesses fetal growth and detects anomalies next.
Could you discuss the importance of early spotter identification in newborn evaluations?
Early identification greatly assists in expediting interventions that may reduce the risk of severe complications next.
Are there additional complications for babies born to mothers with gestational diabetes, besides hypoglycemia?
Indeed, additional complications such as respiratory difficulties and long-term metabolic concerns may arise next.
In clinical practice, what is the complete designation of the glucose challenge test?
It is the screening test for gestational diabetes administered during pregnancy next.
How reliable is this test when diagnosing gestational diabetes?
When used in conjunction with confirmatory testing, it is highly reliable next.
What factors can lead to a false positive result on this test?
External factors like recent illness, stress, or improper fasting can skew the results next.
For surgical interventions addressing these conditions, what preoperative assessments are necessary?
Comprehensive imaging studies and laboratory evaluations are essential prior to any surgical procedure next.
What are the long-term outcomes following surgical corrections in these cases?
With proper execution, long-term outcomes are favorable and quality of life is significantly improved next.
When identifying a spotter in other medical scenarios, what physical findings are significant?
Distinctive skin markings and unusual body proportions often serve as important indicators next.
How does the clinical presentation vary among neonatal conditions?
Presentations can range from subtle signs to overt distress, depending on the condition's severity next.
How critical is timely diagnosis in improving outcomes for these infants?
Early diagnosis is paramount as it facilitates prompt and effective treatment interventions next.
What challenges do clinicians face when determining precise implantation sites?
Variations in uterine anatomy and overlapping clinical signs can complicate accurate localization next.
What is the role of imaging in accurately determining these implantation sites?
High-resolution imaging is indispensable for pinpointing implantation sites and guiding treatment next.
Revisiting the image discussed earlier, how does it enhance a clinician's understanding?
The visual information complements the clinical data and fosters a more comprehensive diagnostic approach next.
What common pitfalls might occur when interpreting such images?
Pitfalls include misinterpretation due to poor image quality or atypical presentations next.
Why are graphs often used to represent clinical data in our field?
Graphs simplify complex data and clearly illustrate trends, which are critical for treatment decisions next.
Which element of a graph do trainees often find most challenging?
Many trainees struggle with accurately interpreting the trend lines within the presented data next.
How can misinterpretation of graph components impact patient care?
It can lead to misguided treatment strategies and delay critical interventions next.
Why is fetal macrosomia a significant risk factor in the context of obstructed labor?
Because an oversized fetus can physically obstruct the birth canal, causing labor complications next.
What preventive strategies are recommended to minimize the risk of obstructed labor?
Preventive measures include thorough monitoring of fetal size and careful delivery planning next.
Can improvements in maternal nutrition help reduce the incidence of macrosomia?
A balanced diet and strict glycemic control are essential in preventing excessive fetal growth next.
How does gestational diabetes predict the risk of neonatal complications?
Elevated maternal blood sugar commonly contributes to increased fetal size and associated risks next.
Is there a genetic component that influences newborn birth weight?
Genetic factors do play a role in determining growth patterns alongside maternal health parameters next.
How do clinicians decide on the intervention method for high birth weight infants?
Decisions are based on detailed assessments of both maternal and fetal conditions next.
What does proper postnatal monitoring include for these infants?
It involves regular blood tests, vital sign monitoring, and continuous clinical observation next.
Are there established guidelines for monitoring newborn weight in such cases?
Most institutions have clear protocols outlining the necessary interventions for macrosomic infants next.
How are mothers educated about the risks involved with high birth weight outcomes?
Counseling covers nutrition management, regular prenatal checkups, and awareness of warning signs next.
In discussing clinical presentations, which terminologies are frequently used?
Terms such as perinatal stress and neonatal adaptation syndrome are commonly used next.
How are spotters utilized effectively in everyday clinical practice?
They serve as early alerts that prompt timely and targeted diagnostic evaluations next.
In what manner do imaging findings correlate with physical examination results?
They provide a complementary perspective that together forms a comprehensive picture for diagnosis next.
How has technology transformed the identification process for complex conditions?
Advances in imaging and data analytics have greatly enhanced our ability to diagnose accurately next.
What role do educational graphs play in training new clinicians?
They break down complex information into understandable segments for more effective learning next.
Could you address how well-managed delivery processes help prevent obstructed labor?
A well-structured delivery plan that includes risk assessment and preparedness can significantly reduce complications next.
How does surgical correction of certain conditions affect future reproductive health?
Many surgical procedures are designed to preserve reproductive potential while rectifying anatomical issues next.
Can the involvement of multidisciplinary teams improve overall patient outcomes?
A collaborative approach ensures that all aspects from diagnosis to post-treatment care are comprehensively managed next.
What follow-up measures are critical after any surgical intervention?
Consistent follow-up examinations and rehabilitative support are vital for sustained recovery next.
How important is effective communication among the care team in these cases?
Clear and consistent communication is key to successful patient management and family reassurance next.
Do you believe that further research is essential in this field?
Ongoing research is absolutely necessary to refine protocols and improve treatment outcomes next.
What advice would you give to emerging professionals facing these challenges?
Remain curious, pursue continuous learning, and always seek collaborative support in your practice next.
As we conclude our discussion, what final insight would you offer regarding these topics?
I encourage all practitioners to integrate evidence-based practices with compassionate care to achieve the best possible outcomes ending.
Thank you for joining us on this insightful journey through complex neonatal and maternal care topics. Stay informed and keep caring.
We appreciate our listeners' dedication to learning and wish you all the best in your professional endeavors.